Let's talk about anxiety and the healthcare professional's role in managing it. Let's first look at the effects anxiety has on our patients. So anxiety can cause increased heart rate and hypertension, and this is especially problematic in our cardiac patients who can't manage an increased myocardial workload. It also commonly causes insomnia, fatigue, and an increased length of hospital stay due to failure to thrive. It can cause irritability, aggression, and an inability to concentrate. These behavioral changes compromises their ability to learn and make informed decisions. Symptoms of anxiety such as nausea, vomiting, and a decreased pain tolerance can lead to polypharmacy. GI upset can decrease or increase the patient's appetite and can cause either weight loss or gain. Nutrition must be monitored. It can cause shortness of breath and panic attacks. Lastly, the increased stress on the body can impair the immune system and make our patients more susceptible to infections. Overall, it causes decreased quality of life both while the patients are in the hospital and once they go home if it's not managed properly. So, what patients are most likely to become anxious? Our resources told us that dementia and psychological disorders are the most common causes. Research showed that females are twice as likely to develop anxiety. A history of alcohol or substance abuse can also be an indicator. Patients claim that uncertainty around their diagnosis and treatment plan is the biggest cause of anxiety. This begs importance to the nurse's role in education. Lastly, lack of social support increases anxiety in patients and decreases their ability to cope with it. So, how do we identify and assess anxiety? Tools can be used to recognize anxiety. However, research shows that talking to patients is the best way to gauge their level of anxiety. The OPQRSTUV model can be used as a guide. However, parts of the acronym don't apply as well as others to this symptom. Basically, though, the nurses should have a good understanding of what's provoking the anxiety, what symptoms it's exacerbating, and what's worked to alleviate it in order to increase their patient's quality of life. Although tools are not ideal in holistically identifying and assessing anxiety, the HAD scale is commonly used in North America. This scale asks questions such as, how often do you feel tense or wound up? Or do you have a sense of doom following you around? The score at the end of the survey measures whether the patient has a low, moderate, or high level of anxiety. We will be implementing this tool on NU5 at CGH to influence nurses in becoming more aware of this symptom of anxiety. The tool should always be complemented by an actual interview of the patient, though. So, after recognizing anxiety, what can we do? Education is a big one in preventing and alleviating anxiety. Patients on the floor have their minds in a million different places, and it makes it really hard for them to learn. It's important that healthcare team as a whole is patient in education of the patient's care plan and making sure that they have the contacts and resources if further questions arise later. Our research also showed that it's highly important we stay on top of symptom management. Through this, our patients are able to trust and feel supported by the healthcare team. Lack of social support increases levels of anxiety. Healthcare professionals are therefore responsible for facilitating reconnection, supporting family members, and potentially organizing family meetings. Patients should also be made aware of the community groups and support systems. Research continually showed that the best approach was a multidisciplinary approach. This includes involving the doctor, the nurse, the social worker, the physiotherapist, pastors, and importantly, the patient and their families. This guarantees that the patient is treated in the most holistic way. So lastly, and most importantly, the best way to prevent and reduce anxiety is for the healthcare professionals to get to know their patients. So give them a listening ear and hear out their stories, learn their limits, and advocate for them when they can't speak up for themselves. This builds trust and relationships. So what are we going to do with this knowledge? Healthcare settings occupy countless patients who experience fear and anxiety. Healthcare professionals must make it a priority to be sensitive to these feelings of anxiety and must factor these feelings into how they work and care for their patients. This needs to be done in order to maintain relationships and improve the quality of life for our patients. Take a moment and think of your role in supporting patients with anxiety. What can you do to prevent or alleviate anxiety?